Here we go. Assessment and Diagnosis, Chapter 6 in your Substance Abuse class. I'm still trying to record with my children here, so just bear with me. I'm trying to get through this. But really, really important to note the first example in your text about the perception of the graduate student and how excited she was because she felt like she had done a really good thing to try to help the client with her parenting tips, and see how she just trudged forward without first listening to her client and following that client with those core conditions that we know in person-centered technique are so important. Making sure you're establishing warmth and trust and empathic understanding so that you can truly hear the client and follow the client, because you may miss what's really going on. So assessment is really important, and that is part of it, building that relationship so you can accurately do that. One of the most important things after the relationship and making sure you're following the client is to make sure that you understand wherever your client is in the stages of change. You would utilize something such as um, the Eureka, the University of Rhode Island stages of change assessment scale, to determine that. You can actually give an assessment. You can also determine it from what your client is saying in the biopsychosocial. So what are they talking about with their substances as you get to know them, and where are they in those stages of change? It took me a minute because I just taught this to the first years and I was about to go into a detailed explanation, but you guys know what this is, right? Pre-contemplation, no way, not now. Contemplation, well, maybe. Determination, making that plan, trying to make sure you're preparing, right? It's preparation, actually. Action. Action, you're actionable. You're doing it. Maintenance, you're maintaining that change for 6 or plus months, and then relapse can occur at that point. What do you do? Where are you, and how do you have a relapse prevention plan to address that relapse? Really important to know where that client is, because if client's in pre-contemplation, you're certainly going to treat them differently than if they're in action when they come to you. And would you make a referral? Someone who's in action, they're coming to work on other goals and they're already working recovery, like going to meetings and they're sober. Maybe they've been to a treatment program. They got out 3 months ago and they're working their program. They're coming to you for other things, and they want to continue to monitor their substance use behaviors and making sure that they stay in recovery, but they have other goals that they want to work on. So it's a comprehensive assessment process once you learn with your client and figuring out what you're going to do with them. A very broad view of substance abuse when you look at the whole process to start. There can be multiple different patterns of use, misuse, and abuse, dependence, and addiction, and this is in your text. So use can be characterized as any kind of use, right? They've used the chemical for, they've tried it, they've smoked a cigarette, they've actually had a beer, but are they misusing or abusing it? Did they just have an experience with it? Did they use it? Much like if you're a moderate drinker, now you go to the doctor and they say, do you drink and how much do you drink? Well, and you would say, I use alcohol 2 to 3 times a week and I drink one glass of wine or one beer or something. That's a use. And so that is something that a lot of people do. And if it is misuse, something negative has happened with it. Something, they've gotten sick, they've been arrested because it's illegal to drink when you're underage. You growing up, getting arrested for DUI. But even that doesn't mean that they are dependent on alcohol. It could have been that they misused the substance at that point. The misuse of that drug or drink may deter the person from using it very often in the future, if at all. But abuse comes in when the person continues to misuse the substance and continues to use it despite the negative consequences. Being grounded, continuing to go out and drink, getting arrested and continuing to drink and drive, continuing to drink alcoholically, getting blackout drunk, getting things happening, right? And that is when it becomes more of an abuse issue. Then people become very compulsive with it and they become dependent on it. And they're completely dependent on alcohol. That is, they think they have to have the alcohol. They can't stop drinking. They have a really hard time not drinking. So when you're counseling someone and you're assessing for this, this is going to be in your biopsychosocial substance use history. You're going to talk to your client about their history with substances. You're going to want to know more about what's going on with this client, and you're going to need to find out what's happening with them. And they may be able to tell you that they've just misused the substance. So you have to really look at it in a continuum. So where are they? It usually is progressive, but it's not always. You just have to look and see what is going on with that client, get to know them really, really well. Assessment, the act of determining the nature and cause of the client's problem. During the early sessions of treatment, you gather data, you ask questions, and you address confidentiality and other. All right, we went into screening, and I wanted to show you guys brief procedures to assess whether or not they need a higher level of a referral. They're not a comprehensive assessment. They're a brief tool to help you know what you need to do and how you need to progress with the client. So let's look at one. This was a brief screening tool right here. How many times have you used tobacco? Never. So we're almost done. See, we're in past year. How many times have you used alcohol? Monthly. In the past year, how many times have you used marijuana? Never. And how many have you used prescription drugs such as pain medication or Adderall? Never. It's a brief screening to brief intervention, S2BI. How many? No, I've done that. And how many times have you used inhalants? Oh, weekly or more. Just kidding, guys. Just kidding. You're all awake. Have I used any K2 or bath salts? Unfortunately, no. Oh, wait a minute. Wait a minute. How did I get higher risk? Just, oh, because I'd use alcohol, I guess. Is this for adolescents? See what my summary is. Huh. I thought it was going to be low risk. But honestly, the whole point was to show you that you have these brief intervention tools, screening tools. I'm assuming this is a brief screen. I wonder if it's for adolescents, because that would be high risk because it's illegal. But I was just wanted to show you guys, this is drugabuse.gov, and there are all these screening tools, and they're really quick, and that was the point. And other tools, let's see if there's anything else. You can just scroll around on here, drugabuse.gov, and you can take these, you can take them yourself or give them to your client. So hopefully that was helpful. Okay, let's move on. You're going to want to know this comprehensive assessment data gathering, right? In the biopsychosocial, you usually have substance use history. But you're going to want to know everything about that. All the background, the problems, current functioning, client's motivation for treatment, who referred them, chief complaint, history of present problem, history of substance use and abuse, life situation, family history, religious history. This is going to be in your traditional biopsychosocial, but you're going to spend more time on the substance abuse portion to make sure that you get all the information you need.